Hi, my name is Lisa Coleman. I'm a student at Eastern Kentucky University enrolled in the Masters of Science Family Nurse Practitioner program. This PowerPoint presentation will discuss childhood and adolescent obesity, the intervention of the COPE program on physical activity in adolescents, and the role of the family nurse practitioner. Childhood and adolescent obesity is a health problem that is prevalent in our country and worldwide. Being overweight or obese, as defined by the World Health Organization, is abnormal or excessive fat accumulation that present a risk to health. Obesity is considered at a BMI of the 95th percentile or greater. Being overweight is defined as a BMI measurement between the 85th and 94th percentiles. Is childhood and adolescent obesity really a problem? Yes, it is. The World Health Organization states the number of obese children and adolescents aged 5 to 19 years worldwide has risen tenfold in the past 4 decades. Healthy People 2020 state that 16.1% of children and adolescents were considered obese between 2005 and 2008. In the state of Kentucky alone, about 36% of children were considered overweight or obese in 2011, and the numbers continue to grow. Childhood obesity can lead to health problems, including type 2 diabetes, hypertension, hypercholesteremia, even heart disease and stroke. Healthy People 2020 state adolescents who are at a healthy weight have less likelihood of becoming obese adults and don't have an increased risk in factors for things such as stroke, hypertension, and they have a longer life expectancy. Therefore, they have an objective to reduce the proportion of children who are obese or overweight by 10%. In their review of the 2 selected studies, both Melnick et al. And Ardig and Erdogan utilized the COPE, or Creating Opportunities for Personal Empowerment, Healthy Lifestyles, Teen, Thinking, Emotions, Exercise, and Nutrition program. They use this program versus a normal health class, and in this they evaluated healthy lifestyle behaviors, BMI, psychosocial outcomes, social skills, and academic performance of adolescents. The only difference in the 2 studies is one was conducted in the southwestern United States and the other in Istanbul, Turkey. For the study in Turkey, the researchers translated the information, renaming it Turkish COPE or T-COPE. The independent variable in both studies was the use of the COPE program, which was a 15-week, once-per-week session that included specialized education, physical activity component, and the use of pedometers and a log to record steps by the participants. The results that were evaluated for the purpose of this integrated review and PowerPoint presentation was only the difference in physical activity of the adolescents as documented by the average number of steps. The results for both studies showed a significant difference or large improvement in physical activity with the intervention group compared to the control groups. This information is very useful for improving nursing practice. Advanced practice nurses need to establish a dialogue with their patients and their families regarding a healthy weight, healthy lifestyle habits, including good nutrition and physical activity, and why these are so important. The study showed that the students in the intervention group had greater knowledge and understanding of nutritional choices, the importance of physical activity, and how to make healthy lifestyle choices. A proposed intervention would be to mandate a COPE healthy lifestyle class to replace or in addition to the current healthy choices or nutritional portion of the current health class that is administered in middle and high schools. This would have to be in collaboration with the school board and health departments. An appropriate environment for this implementation would be in middle and high schools. In the state of Kentucky, it is required that students take a health class. The COPE program could be incorporated into the basic health class. This would have This would include the backing and support from the school board and local health department. Currently in Kentucky, the local health department staff nurses in the schools. In summary, adolescents are at a prime age to start making choices for themselves, and it is the responsibility of family nurse practitioners to encourage them to make healthy choices that will impact the rest of their lives. Thank you for watching my presentation. If you have any questions or any comments, please feel free to contact me at the email listed.